Thank you. Welcome, everybody. We're happy to have you. Thank you for joining us for our annual Human Health Alumni Panel. We have 4 panelists. One is going to join us a little bit later. He had a work call that went over. So we've got our 3 awesome panelists that are going to kick us off. I am going to just ask them to briefly introduce themselves, and then we have 2 of our student advisory board members who have helped plan this event alongside the alumni department at Emory, and they've developed a list of questions that we're gonna, our 2 students are going to ask them. And then at the end, we'll end at about 6:45 to 6:50, and we'll open it up to anybody else who may have any additional questions for our panelists. So we will go ahead and get started here. Feel free to turn on your cameras if you'd like. Sometimes it's helpful to talk to some faces. We'll go ahead. I'm just go down my YC first. Sarah, if you don't mind starting and just introduce yourself, when you graduated, what your majors, minor were, and where you're currently working.
Sure. Hi, my name is Sarah. I graduated from the college with a double major in human health and international studies. Human health was my, I guess, primary major, but then I realized I had extra time in my schedule to also take on international studies. And I then graduated from Rollins School of Public Health as well, in their global health department this past spring in 2022. And then I am a presidential management fellow at the CDC, working in their division of global health protection, working with 3 international offices with their operations and management.
Awesome, thank you. Anna, if you don't mind.
Hi, everyone. My name is Anna. I graduated from the college in 2018, and I had studied human health, which was also my primary major, and also African studies. And currently I work for the Federal Emergency Management Agency. I don't have my master's, but I'll be returning to Emory this fall in August to get my master's at Rollins, to earn my master's of public health. Thanks.
Thank you, Anna. And our 3rd panelist, Janae, if you don't mind introducing yourself as well.
Sure. Hi, everyone. I'm Janae Dunkley. I graduated from the college in 2019 with a major in human health. I also received my MPH from the Rollins School of Public Health in 2021 with a concentration in behavioral, social, and health education sciences, as well as a certification in maternal and child health. I'm currently an ORISE fellow at the CDC in the National Center on Birth Defects and Developmental Disabilities. And my primary work is focused on partnering with interdisciplinary stakeholders and supporting surveillance efforts to improve health outcomes for children and families affected by prenatal substance exposure.
Awesome, thank you, Janae. All right, so those are our 3 panelists. We're gonna kick it off here. Our student advisory board, Ivana, is gonna ask 4 questions, and then Juwan will jump in and ask another 4 questions, and we'll wrap up for additional questions at the end. Ivana, if you wanna take it away and start the questions, that would be great. Or maybe it will swap. Juwan, can you start the questions and we'll have Ivana do the second? Okay.
Yeah.
Yeah.
Okay, so our first question is, what experiences, such as classes, internships, jobs, research, do you feel like set you apart or best prepared you for where you are right now?
Are we just going to hop in with whoever? I can take it first. So
Sorry.
Sorry. Okay, I'm just gonna keep going. Something that I think is really important to keep in mind is what you want to go into, because public health is a very, very large field. And so for me personally, knowing I wanted to go into global health, you can see that there's a gap between when I went to Rollins and graduated from my undergrad. That's because I served in the Peace Corps in Togo for a year. COVID brought me home, so then I went to get my master's degree. But getting international community health education work was really important to me, to be able to continue that in a career and being able to find, even if it's a community service opportunity, if you're interested in food insecurity, volunteer at a food bank, like finding ways that you can take what field you're interested in and find however much you can add interest or experience related to that to your resume is very helpful.
I can jump in. I was also a Peace Corps volunteer in West Africa, but I was in Guinea in West Africa. So I think, as Sarah said, pursuing those kinds of experiences, if you know for sure you're interested in global health, is definitely a path you could pursue. And then while I was still at Emory, I did 2 study abroad programs. And so while I was still a student, I think that was a great way for me to be exposed to other cultures and have that, immersion experience, learning other languages, and then also, knowing if being abroad was something that excited me or was interesting or curious for me. So I think study abroad is like the best thing I could recommend if you think that you're interested in global health. And then also, of course, I had a work study job. And so I think getting any kind of research or work experience, perhaps doing research, can also clue you into if that interests you. So thanks.
Yes, I'd have to say, in the budding stages of my career, volunteer work definitely helped me kind of understand how I felt going into the maternal and child health field, and whether or not it was a good fit for me. I knew that I had a primary interest in developmental disabilities. So majority of my volunteer experiences were at foster care agencies, and I also volunteered at Children's Healthcare of Atlanta, which was very convenient, being that it was right across the street from campus. So yeah, I would say that volunteer experiences are very important in the undergraduate level of your career.
Thank you all so much. The responses are really helpful. Okay, so the second question is, how did you market yourself or explain yourself to human health as a human health major, and with your background to your employers?
Someone else can go first, or do you want to just go in the same order? Whatever, you can go in if you're ready.
So I was gonna say that something that really interested me in studying human health at Emory was the prevention aspect of public health, where we're trying to prevent these diseases amongst a population, not necessarily how it's different from medicine, where we might be treating diseases after they've happened. And so I think for my job at FEMA, the current job I have is in pre-disaster mitigation work. And so in our program, we work on awarding communities with money so that they can do pre-disaster mitigation. And so I think that tie into the preventative aspect, was really applicable for me. So I think finding, while it might be a little bit more of a loose connection, but finding those connections and like those common threads throughout your experiences are a great way to market yourself, and also just to stay curious and always be learning.
So for me, I always tried to draw from both my personal and professional experiences to kind of market myself in the maternal and child health field. So again, going back to my volunteer experiences, and also the fact that my family was very much so involved with the foster care system. So that was very much so my introduction to the realm of developmental disabilities. And I think what really helped me market myself in this field was understanding the humanity that goes into data. And I think oftentimes that can get lost in the field. Again, having that personal experience with the populations that I was working with, but also drawing from my epidemiology courses, and also taking the time to personally go and take certification courses, whether it be through Google or Coursera, to become well-versed in other statistical languages. So that was pretty much how I marketed myself as well.
I think it's also really important to, and this is something that I've learned in the past few months, is spend time on LinkedIn and look at careers that you would be interested in, or people's jobs that you would be interested in having in years, and see what they did to get there. Maybe they did a training on some sort of statistics platform that now they use in their current day-to-day job, or some sort of, I don't know, code system. So it's really helpful to be able to see what skills people have in the career that you're interested in, and realize that, okay, how can I gain those skills as well? I think something that's also been really helpful for me is networking. And I know that that term is used so often, especially on panels like this, but it's when you can have someone who's in a higher position say, you know what, Sarah is a hard worker and she's passionate about this field. I'm going to go ahead and set up a 20-minute coffee chat with someone who I think Sarah would work really well with, or Sarah would be interested in what this person's doing. And that has been really integral for me, even within the CDC, to be able to constantly have these coffee chats. So when I do want to change roles, or I do want to think about a different field I'd be interested in, I already have all these connections that I can leverage.
Thank you. So our third question is, what inspired you to begin working in this field and in your respective jobs, and what keeps you passionate about it?
So for me, I distinctly remember taking a course with Dr. Michelle Lampel. I believe it was called Predictive Health and Society. And in that course, she introduced us to the different realms of public health, and some guest researchers and instructors would come in and they would speak on environmental health, infectious disease, chronic disease. And it was really great to have that exposure to those fields. But it was one lecture in particular that Dr. Lampel exposed us to the field of maternal and child health. And that just made me sit up straight in my chair and tune in. And, you know, that was my bread and butter. And before then, I had never given much thought to how our origins of life could have a substantial impact on our health outcomes, nor had I ever considered the intergenerational consequences that poor health behaviors could have. But I was really intrigued at the idea of approaching health issues from a life course perspective. And so I wanted to pursue a research career in maternal and child health. So I connected with Dr. Michelle Lampel, and she also connected me with Dr. Christensen Lindquist. And through her, I fell in love with the realm of epidemiology. And so that kind of had a domino effect for me to go and get my master's. And it was just really nice to see that for the things that I was most passionate about, which was making an impact in the lives of mothers and children, there was a realm for me to do that.
Something that I really liked about the human health department, now I will say when the three of us were in the human health department, it was much smaller and only a few years old. And so I remember that there's been so many classes added, but I remember, I think it was my sophomore year, like global health 100 or something. There was only one global health class. And I remember it was taught by two professors at the School of Public Health, and including Dr. McFarland. And she brought in a few Peace Corps volunteers to speak about their experience. And that kind of was my first, glimpse of hearing that. So then in a few years later, I was like, okay, I'm going to apply, obviously did a lot more research into it and interest into it. COVID happened. I was back at Rollins, was in a year ago in a program management class with McFarland. And she had a presenter come in on the PMF program. And so it felt very full circle for me to be able to have like the same professor give the same guest lecture or bring in the same guest lectures for two major parts of my recent career. And so I think that's something that's been really helpful, that if there's a speaker that interests you, or someone who even you read a passage in a class and talk to the professor after class about that passage, or talk to the guest lecturer, because you'd be so surprised how much these professionals are willing to give you advice on how they got to where they are, or who you might want to network with next. So definitely lean on those people as much as possible.
I think that's great advice. And Janae, when you brought up the lecture with Dr. Lampa, I could think of that one too, thinking about how a baby's cells are first originated from their grandmother. So thinking about that life cycle aspect can definitely speak to the impression that we both had. I would say that the reason I became interested in public health at first, I kind of knew my mom was a nurse, and I knew I was always interested in health and maybe wellness, but coming to Emory, I realized, I could actually study this in the form of public health and not necessarily medicine. I think medicine was always a little bit intimidating to me, and it also seemed like a lot of school. And what really appealed to me about public health was the aspect to impact a whole population through certain policy or programs rather than by the individual. And I think also that prevention aspect of, being able to prevent harm before it even begins. I think that there are so many cost-effective ways to also impact health. And so a lot of those factors were just really interesting to me. And so that's kind of why I stuck with it.
Thank you. Okay, so is there any advice that you have for someone who's interested in a job position or field similar to yours that would make them more marketable?
I think Sarah's earlier advice on really, looking at LinkedIn, looking at different job descriptions and seeing what they require of their applicants or what they're looking for in an ideal applicant is really helpful. You can, go after those certifications and even those online Coursera programs. I'm taking one right now to get at least a little bit of a baseline in R coding before I go to school this fall. I think there are so many, useful certificates and programs on the internet that you can really leverage. So.
Yeah, sorry.
Go ahead.
Yeah, one thing that I've definitely learned in the path of my career is you're never going to stop learning. So on my team, I work with people who have their PhD, and they've been working at the CDC for about 15 years, and they're still attending trainings and webinars because this field is always evolving. So yeah, going back to taking the certificate courses, also talking to mentors, making those connections to see, the direction that the field is going in, so that you're always on top of it and you're staying up to date with, what's popular in the field. And perfect example is right now, and in terms of if you are seeking to go into data analytics and things like that, I'd say that there's more of a shift going from SAS to studying with R. And so with that shift, you're constantly learning and you're developing those skills. So I would say just being varied in your experiences and always being just constantly learning is definitely going to make you more marketable.
And I think also something that Anna mentioned before is, if you are interested in domestic work, no matter what field that's in, having something on your resume that is related to that, or that they can read your experience, say, oh, they have experience in, doing field work or in doing project management. So they can also apply that to, even a different sector. But, again, being in global health, everyone I work with has other experience in global health. And so that is really important to try to have those experiences, because they're more likely to pick someone who is not going to have to go through the most amount of learning curves, who is going to understand already what it looks like to travel abroad or to work in the field or work with community partners. And so that's going to be really important. I also think it's important to know how important academia can be. I'm not saying everyone has to do, I think it's interesting pool because the three of us have gotten our master's in public health or will be getting our master's in public health. Not to say that you have to do so, but it is important to look into, if you want to be a doctor, you have to go to medical school. There are certain ceilings for certain jobs where to get the next step up or to supervise someone, they will be looking for someone with a secondary degree in certain fields or certain positions. So it's important to know, maybe certifications can get around that. And so it's important to know where you potentially might have to alter your path a little bit, and definitely look at people again on LinkedIn who have positions you're interested in. Maybe they don't have a secondary degree, maybe it's not necessary, but that's helpful to have in mind of what like your next 5 years look like.
I think that's great advice. And I want to add one more thing, kind of also back to what Janae said about volunteering. So you don't necessarily need to, volunteer for 2 years in the Peace Corps to know that you're interested in working with global populations. Like maybe you're working at a refugee center once a week or a couple times a month. So, don't try to limit yourself or don't try to extend yourself way too far. You can definitely get a taste of these different fields and see what you're interested in without committing 100%.
I also like to say, in addition to going on LinkedIn, you can simply just go to the job listings that you're interested in, and you'd see like the degree requirements, the statistical languages that they would prefer that you'd be well versed in, or the software that they prefer you to be well versed in, and kind of just align that with your learning curve.
Thank you so much. This is also great advice. So our fifth question is, what difficulties did you face while pursuing your area of interest? And maybe if you could explain about how you had to go about those difficulties as well.
I mean, I think we can all agree that COVID provided a lot of difficulties in a position, and I think that's especially for if you were a student in college or even in high school during the pandemic. That provided a lot of resiliency, and you had to be flexible, and that allows you to potentially apply that to a job position. But I was in the Peace Corps and was brought home with COVID, or not with COVID, but during the pandemic. And it's provided me, I made this 5-year plan. I was going to extend my service, be there for 3 years, and then go to Rollins. And I think that kind of grounded me a little bit to realize that in life or in any career path, there's going to be wrenches thrown in it. And again, then I went to start this fellowship in August, and this CDC is currently going through a lot of reorgs right now. My division and my office have already gone through reorgs. I'm on my 3rd supervisor right now. And so when you're new in a role, it can be really hard to try to get an understanding of what you're supposed to be doing or what, learning curves there are when all this change is happening. And so that's why definitely having mentors has been really important to me. In my fellowship, I'm required to have a mentor, like on paper, who's required to meet with me. And then I also have other more informal mentors. And that's been really helpful for me to ground myself in understanding, what does this mean for my career? How can I use my experience of having some frustrations in my workplace to use that as like how I've been able to adapt in my workplace? And just having people who have been in similar positions or who have years under their belt to provide mentorship has been really helpful to kind of ground myself in those hurdles or obstacles that I've encountered.
So I think the hardest thing for me has definitely been imposter syndrome. And I think that we can all attest to some form of imposter syndrome. But I think what's definitely helped me is just coming to a place where I've realized that in terms of who I'm connecting with, whether they're in a higher position where they're hiring me, or I'm seeking them to be my mentor, that person has gone through the trials and tribulations of life time and time again. And so oftentimes when they're looking at me, they're seeing their past self. So in terms of what I see as my limited capability, there's a level of understanding there. And there's a level of grace there and patience and understanding. So I would say that not that those feelings of imposter syndrome aren't valid, but I would say not to give too much attention to that. Whether you are in the preliminary stages of your career, there's an understanding that you are progressing, and there are people that are around that are going to help you out along the stages of your career. Guarantee it. So, there.
I guess my answer would be similar to Sarah's. Of course, like the pandemic shifting our whole path probably a little bit off course. A big challenge for me too was after I came home from Peace Corps service, because of the pandemic, I immediately got a job. I started working, and I always had public health school in the back of my mind. I always knew, like, yeah, you know, I still want to do it. I still want to do it. I think that working in a job though, and you know, being settled in a city was really easy to maybe be a little stagnant. So I think just, you know, keeping that momentum to work towards my goals, but then also, you know, as Janae said, giving myself grace of, I don't need to do everything right now. As long as I keep my eye on the prize and keep those goals, you know, within reach, as long as I'm still working towards them. I think that's important.
Thank you. That sounds good. What are some myths or misconceptions about the human health major that you'd like to refute or clarify if you came across them?
I'm not sure I know of any myths, but if US students like have any that you know are floating around, let us know. But I think it was like a pretty well respected major when I had graduated.
I agree. I think one thing that I remember from when I was in the human health department is that a lot of people who are in the human health department either are still like everyone, a lot of people go to Emory thinking that they're going to be in go to med school after. And so I feel like there is a duality of students who are in the human health major who still wanted to go to med school, and students who were maybe considering it, and then students who were not considering it at all. And I think it's important to know that human health can be applied to so many careers and so many fields. And sure, it would be great if you had a human health major and then you went to medical school, but that doesn't necessarily mean you have to go into medicine, nor does it mean you have to go into public health. So I think understanding that there are so many great things you can learn from the department that isn't directly related to it being like baby bio courses, I think that is something to ground yourself with.
Yeah, definitely have to agree with that. I will admit, initially when I got into the major, I thought that I would go into med school afterwards once I graduated, but I didn't apply to med school. I knew that I wanted to get my master's in public health because I think the human health major really opened my eyes to the many different avenues that I could pursue if I did stay within this field. So, I mean, it could range from health IT to working for the government or state government or nonprofit. There's so many values and skills that are just applicable to so many different career paths. So, yeah, I definitely think that there's no shortage of opportunities to come from being involved with this major.
Thank you. So, also, how does the human health major work in conjunction with other majors or areas of study?
So I don't know, sorry, I don't know if this is the same, but I thought it was very unfortunate that there was a School of Public Health at Emory and no public health major for undergrad. And I knew I wanted to go into public health pretty early. And I remember I made this Excel sheet to figure out like what semester I'd have to take each of my classes. And I realized I had a lot of room in my junior and senior year to add potentially another major. So I added international studies, and I loved pairing international studies with human health. I found that that had a really nice, there were classes that related to each other. I was taking global health classes. I was taking classes on, international relations. And I feel like that really set me up to go into, to market myself, that I've taken classes on, in both, but they kind of together, if you squint, like international studies and human health can be public health too. So I really liked combining those classes, and I highly recommend taking international studies classes if you don't even want to major in it.
So I would say one of the basic tenets of public health is understanding human behavior and understanding what drives what we do and why we do the things that we do, and understanding our societal structure and how that all comes into play. So when we consider like the social determinants of health, I really think that classes such as sociology, anthropology, gender-based studies, they all come into play with having that nuanced understanding of how health varies and how disparities come about, especially in American society. So I think that intersection of those classes and some of our public health courses would be really instrumental in terms of kind of bolstering our understanding of how those things interact.
Another, to add on to what both of you said, another important intersection I found was between my public health studies and African studies. And so, of course, yes, the behavioral and the social aspect, and also very much the historical aspect. So if you're looking at global health, future, I think that taking a few classes in African studies, I'm not sure if you did that in international relations, was really eye-opening for me to learn a lot of these, colonial structures and histories that still exist on the continent, and also in a lot of how work is done on the continent, even if it's, well-intentioned public health work.
Thank you all so much. I have one more question for me, and then we can open up the floor to everyone else in the Zoom to ask. So in what ways does the graduate school experience differ from the undergraduate experience?
I do want to just, before we continue, I just want to introduce Brian, who was able to join us here. I know he had a work meeting that went a little late. He is our fourth panelist. Would just, before we get into that last question, would love for him to just introduce himself, when he graduated, his majors, minors that he graduated with, and where he's currently working and or at school.
Hi, everyone. Sorry for joining late. I'm Brian Azema. I graduated from Oxford in 2016 and then Emory College in 2018. I was a human health major, no minor. And the last thing was where am I now? I'm a third-year medical student in New Jersey. I go to Hackensack Meridian School of Medicine. I haven't decided on my specialty yet, but yeah, I'm still in the process of getting through it. So happy to be here and answer questions and help out in any way.
Thank you. Juwan, would you mind repeating your question again, and then we can, that last question off.
Yeah, so the last question was, in what ways does the graduate school experience differ from the undergraduate experience?
I think it's really, at least for me, it was really, I don't know if inspiring is the right word or interesting is the right word, but when you're in college or undergrad, at least, everyone is interested in all these different, careers or jobs, or even they just have different majors than you, which is great to be surrounded, especially at Emory, is so interdisciplinary. But when at least going to Rollins, Rollins is a big public health school, so you still get those interdisciplinary touches. There's multiple different departments at Emory School of Public Health, but then also in the global health department specifically, there were concentrations you had to pick from. Then people do their theses on different topics. So you can learn about a lot of different topics still, but to be surrounded by like-minded students who are passionate about the same things as you, interested in the same career path, it's really, I don't know, it makes it a lot more invigorating, I guess, where you're just in class with people who are excited to be there. That sounds really nerdy, but if you're going for graduate school, you probably have a little bit of nerd in you. And so that's what I loved about graduate school. I will say I was very involved undergrad in, being president of different clubs and all these different things. And in graduate school, I was a lot more focused on my jobs. And I liked that you could do that you could be a working professional and also in school, and it allowed you that flexibility. When being a work study student undergrad felt like you were having to run between classes and, run from your work study to your class back to your work study. And so I really liked that about graduate school as well.
Yeah, for me, once I knew what I wanted to do, it was really nice to have a curriculum that was specifically tailored to my interests. And so I think that was something that was missing in my undergraduate education, aside from, the few lectures where maternal and child health would be kind of a talking point. Being involved in the maternal and child health certificate kind of gave me that boost that I needed to really understand my place in the field and where I wanted to get involved in. Also, I was very particular with where I wanted to go to graduate school, and Rollins was just the best fit in terms of the connections that it had to the healthcare industry, to the nonprofit industry, to the CDC. And so I would say, even though my primary interest was in the realm of developmental disabilities, being at Rollins, I was able to get exposed to reproductive health and just many different aspects of maternal and child health. So I had the opportunity to still work at CHOA and do research in the cardiac and arrhythmia services line. I had the opportunity during COVID to do contact tracing with the Georgia Department of Public Health. I had the opportunity to work with Sister Love Incorporated, which was a nonprofit serving Black and Latinx women in terms of connecting them and understanding their attitudes towards medication abortion. So it was just a very varied experience, which I could only credit Rollins and my graduate education to exposing me to.
Brian, if you have any insight in the medical school realm, since the other three are public health, and kind of how your experience in the med school has differed from your days in human health as an undergrad.
Yeah, kind of similar thoughts. I feel like when someone goes to medical school, the people that are there are all there for the same reason. So being able to kind of see that kind of passion for getting that degree in like almost everyone there, not everyone obviously, but almost everyone there is really good. But yeah, I definitely feel like in terms of managing time, studying, it's very, very different. But again, kind of how it is with undergrad, you just adjust and adapt as you get there. It's very hard to go in with a plan and stick with it, especially with medical school. So I think being able to be adaptable, being able to get feedback from other people, change, things like that, those are skills you work on more, I feel like, as you go up in graduate programs, as opposed to an undergrad where you kind of just try and make sure you kind of get to the next exam, next course, next class, everything. So it's kind of the big difference that I've seen so far.
Thank you. I think those were all of our questions, Juwan. Thank you for asking those. I do want to just circle back real quick to ask Brian just a couple of them, since we have a little bit of extra time. Brian, one of the questions that was asked earlier was, what inspired you to begin working in your field? Or for you, what inspired you to go into medical school, and what keeps you passionate about it?
This is kind of perfect because I feel like a lot of the experiences that I got at Emory really helped me solidify my decision to become a doctor. So after I graduated, I spent 2 years at the CDC doing research. And during that time, I felt like I was able to really fortify why I want to become a doctor, why I see myself helping others as a career. There's a lot of ways to help others, I know, but I felt like for me, the best way to do that was through medicine. So I feel like being able to kind of take that time off to figure out what was best for me after going through 4 years at Emory, I feel like that was really what kind of set me towards medicine and kind of locked that decision in for me.
Awesome. And did you have any difficulties promoting yourself or applying as a human health major as opposed to maybe being a bio or chem major?
That's a great question. None at all. If anything, I felt like it set me apart because, like you said, there's a lot of people that come in with the same kind of majors that you expect for a medical student to be applying with, but there are a lot of public health, human health majors out there that want to become doctors. And that's a reason why I'm actually here today, because I want to be kind of an advocate for that and help people that want to go this route get there. So uh, yeah, I felt like I got a lot of questions about it during the interview cycle because it kind of stuck out to them. And a lot of my experiences were public health experiences, but obviously I was going in with medicine with the expectation to become a doctor. So with that, I kind of was able to spin what I learned at Emory to what I hoped to learn as a doctor. And it worked out really well for me. So I really hope that I can help others do the same.
Yeah, that's great. It's great to hear that. One of the questions we also had was what experiences do you feel like set you apart and best prepared you? So I feel like you also kind of answered that question, but is there anything else in particular that you feel like sets you apart when applying to med school and kind of being in your current program?
I would say this research again, what I did at the CDC really helped. I was involved in a bunch of the other clubs at Emory that were kind of like pre-health clubs, but I think I really didn't find my true passion to become a doctor until I was able to see experiences outside of the hospital and then kind of see how that would fit with what I want to do as a doctor. And with that, I was able to kind of make sure that I was doing the right thing. And in the end, I feel like I still am. So.
Awesome. And then last question I'll ask for you before we open it up to other students to ask anybody any additional questions. For you, Brian, were there any difficulties that you faced while pursuing getting into med school or that you're currently kind of facing that you feel like you've had to overcome and how did you do that?
So I'm not the best test taker. So I feel like that was my biggest difficulty, like getting in because I took the MCAT twice or the admissions test for medical school twice. And I think the biggest lesson from that is just asking for help. I feel like a lot of people that are in this course going towards medicine are prideful people and asking for help isn't like the best thing that they're known for. But I think just being able to kind of see that I needed to work on a few things and get better at certain parts of taking exams and everything that I was able to kind of grow as a student. So yeah, I think just being able to recognize my weaknesses and kind of try and seek help to grow from them as opposed to just kind of sitting there digging a bigger hole and just not being able to appreciate what I need to work on.
Thank you for sharing that. I think sometimes it's humbling for us to realize like some of our weaknesses, but to figure out how to work through them and work around them to get to where we want to be. So it's helpful to see people where you are and where we might want to be and, hear about some of the struggles and how you're overcoming them. So thanks for sharing that. We'll go ahead and open it up. If any other students have a question, you can unmute yourself and feel free to ask. You can ask it to a specific panelist. You can ask it as an open-ended, just specify if you are asking to a specific person or to a specific topic. So we'll go ahead and open it up for any additional questions. And if we don't have any, that's fine too. I'll just I think I'll wait another minute or so if anybody has any questions they want to ask.
I have a question.
Sure,
Right, can you
go
hear me?
for it.
Okay, gotcha. Hi, my name is Bonatembo. I'm actually at the Oxford campus at Emory. So I was just wondering, like, was it easy to get like internships like within like the CDC? Because right now I'm a sophomore, and then I feel like it's like not that many opportunities, especially for like CDC internships. So I'm just wondering, like, when the if any of it from Oxford or just like the within like of Emory, how easy it was to get an internship, and like what would like the qualifications needed.
So for me, I didn't get my first opportunity to work with the CDC until I was in my master's program. I think it was a little more difficult before then. Rollins had a really great program called Rollins Earn and Learn, which was essentially a work study program. But that was my introduction to the CDC. And I think one of the better ways of being able to get your foot into the CDC is if you, again, form a connection with somebody who's already working there as a mentor. People are always willing to help or utilize their own connections to say, I might not be able to help you, or there might not be a position within my division, but I do know somebody in another division that is looking for an intern. Or so I'd say that's kind of the easiest way of finding those opportunities. And just utilizing those relationships, sending a cold email or, things of that nature to just kind of leveraging those relationships to see where there might be an opportunity.
Thank you.
I was just going to add that it's hard being an Emory student where the CDC is right out your window. And obviously the CDC is a major public health agency that a lot of people, fixate on the CDC being the end all be all. And as someone who works at the CDC and I love my job, I want to emphasize that the CDC is not the end all be all. There are so many small local organizations that are needing extra hands to be able to help. Even on the weekends, just if you have a few hours to volunteer, there are so many, or there's even, potentially organizations that are able to pay someone to help work with them. And so definitely the CDC I encourage working for if it's a possibility, but as mentioned, especially as an undergrad, there are way less opportunities to get involved that I wouldn't, if an opportunity does not arise, don't let that discourage you, because there are so many other opportunities, especially in Atlanta. Atlanta is the public health capital of like the nation, that there are so many public health opportunities to get involved with locally as well.
Thank you.
I also am curious if you all remember what your favorite human health class was and or like human health instructor at the time when you were here, and would love to hear what those were for you guys.
One of my favorite classes was textbook to table. I think it might still be on your course list, but you get to cook in that class, and it's with Dr. Jill Welkley, and she was my advisor. So I thought that class was great. I got to take a few classes at Rollins, one in global maternal and child health. And I think epidemiology I also took at Rollins with Dr. Christensen Lindquist, and I thought that was just really foundational for any career in public health.
Yeah, I have to agree. Definitely epidemiology with Dr. Christensen Lindquist. I also enjoyed my classes with Christopher Eagle. Yeah, his classes were always very unique. I loved the readings. I also enjoyed Dr. Cassandra Quave's classes, food, health, and society. I mean, she's a force, honestly. Yeah, I really learned a lot from being in her class as well. And there's also a special topics course. I'm not sure if you all still offer it, but it's like a Health 385 course. And it was with Dr. Bobby Patterson. I believe it was Dalai Lama's ethics, but that class was, I mean, Dr. Bobby Patterson, she's the sweetest person ever. And I really like the humanity that she brought into the classroom. And that was something that I really wanted to bring into my work as well. She was very compassionate. So yeah, just as a human, to learn a lot from her.
I took a lot of classes by Dr. Hobbs. So I took a lot of nutrition classes, and there was a nutrition fact or fiction class, and there were about 8 of us in this class. And we had to, our like main project for the whole course was to pick a taboo food topic. So a diet or like something that was a fad something. So I picked microwaves, and how there's like a group of people that believe that microwaves are a horrible device. And basically you had to find where the evidence lies on what is true. And so some people gave evidence that the diet was actually true because there was enough to back it up. And I really loved that class because it made you think outside of the parameters of a textbook. You had to really go out and look at the research and look at what people were saying on social media about it. And I really loved that class. And going off what Anna said, I also took a birth and global health class in the nursing school when I was an undergrad. And that class was awesome to be surrounded by mostly nursing students who were doing something completely different than I was doing. And I really liked the interdisciplinariness of that class.
I don't remember a lot of the class like names, but I remember professors. Dr. Eagle was one that I had. I really enjoyed his course. Dr. Hobbs as well. Dr. Lample too. I think we had our final like human health course with her, and that was a really good course for me in terms of just learning a lot. And a lot of my like peers that I've kind of gone through the whole major with were there, so it was good seeing them all at the same place. So yeah, I would say those 3 professors kind of stick out to me.
Thank you guys for sharing that. It's probably helpful to kind of hear like what classes inspired you and what instructors really stuck out to you guys, and what kind of helped you inspire you and get you to where you are. So are there any other questions before we end here? Any last questions from anybody? Speak up now. Okay, I think we are good to go. Panelists, thank you guys so much.
Yeah.
Go ahead.
Excuse me. I have a question. Wait, is it alright if I get like emails? Because I'm thinking of emailing like a few of you guys just for like opportunities. That'd be really appreciated.
Yeah, if you guys don't mind, I don't know if the best way is maybe I can get the panelists emails who don't mind sharing it, and then I can send them out to those that were in this session, or I can send them just to you, or if you guys want to post them in the chat right now. Amber, do you have a best way?
No, that's
that you think?
perfect. Whoever's comfortable, there they are. They're posting them in the chat. Copy and paste them, take screenshots, do what you got to do. This is your opportunity. And thank you guys so much for joining us and taking the time, and also sharing your contact information so you guys can make great connections. So thanks.
Thanks, everybody. We'll stay on just a few minutes for anybody.
All right, thank you.
For anybody who wants to add in their emails and take pictures of that.
Yeah, I'm on for another 3 minutes. I'm going to stop the recording now.